Good morning, everyone, and welcome to the hybrid meeting of today's Podiatric Medical Board of California Board meeting. I'd like to call this meeting to order and ask Kathleen to take roll to establish a quorum. Present.
Daniel Lee.
Present.
Ms. Darlene Trulio Elliott.
Here.
Ms. Samantha Chang.
Here.
Dr. Devin Glazier.
We are.
Well, I guess you do. And Dr. Sumar Patel. Okay, so we are missing Dr. Glazier and Dr.
So that's 4 board members. Can I confirm that that is a quorum for this meeting?
Yes, we have a quorum since there are 4 board members, and to note for the record, 2 are in Sacramento, 2 are in Riverside, which is allowed underneath Backley.
Fantastic. Thank you very much. We'll proceed. I'd like to welcome everyone to the board meeting. This is our first time doing the hybrid meeting, so I appreciate everyone's patience and kindness as we get used to this way. Darlene and Sammy, good morning down in Southern California. I'm glad to miss being with you in person, but thank you for joining the meeting today. I'd like to open the meeting for public comments for items that are not on our agenda for this morning. Of note, the board may not discuss or take action on any matter raised during the public comment section, except to decide whether or not to place the matter on the agenda for a future meeting. Are there any comments from the public for items not on the agenda?
This is the moderator. We would like to check in with the Sacramento location first. Is there anyone in public available in Sacramento? And while we're waiting, let's go over the ground rules. Public comment will be given 2 minutes to speak, and I'll give you a 15-second warning before time expires. For people online, you can raise your hand by tapping that hand button at the bottom of your screen. Dial-in users will need to dial *3 to raise a hand. And for our mobile device users, you'll need to hit the ellipses button, that's the ... and cycle through one of 3 pages if you're having trouble finding your hand button. Next, let's check in with Riverside. Is there any member of public available in Riverside? I'm sorry, can you repeat that? Are there any members of the public at the Riverside location?
We do have one member of the public, but as observation, unless they wanted to speak.
Hi.
No.
All right. And let's
Also,
check in.
we have one more member that just arrived and will be coming up the elevator right now.
All right. While we're waiting, let's check up on our WebEx participants. Are there any members on WebEx who would like to raise a hand or who would like to make public comment for items not on the agenda? Now is the time to raise a hand by tapping that hand button at the bottom of the screen. Dial-in users dial *3 to raise a hand. And we're going to take just a few more seconds to see if we have a request for public comment. Seeing no request for public comment, do you wish to continue with the agenda?
Yes, thank you very much. I would like to acknowledge that an additional board member has joined us in the Riverside location and ask Kathleen to take attendance again to confirm.
Okay. Dr. McAloon.
Here.
Dr. Lee.
Here.
Ms. Trulio Elliott.
Here.
Ms. Samantha Chang.
Here.
Dr. Devin Glazier.
Here.
And Sumar Patel is not present.
Fantastic. Thank you very much. Welcome, Dr. Glazer. Good to see you across the screen.
Good to see you too, Dr. Matson.
We're going to move to the fourth item on our agenda, which is review, discussion, and possible action on the board meeting minutes from our last meeting, which was on February 23rd. I appreciate you all reviewing those ahead of our meeting. Is there any discussion on the minutes as they're presented to us? Any corrections, comments, or concerns from the public members with us today? Hearing and seeing none, are there any comments or concerns from the board members in regards to the minutes from our last meeting? Hearing none, may I request a motion to accept the minutes from our last meeting?
Motion to accept.
That's Dr. Lee.
Do we have a second to accept the minutes, please?
We have a second in the room.
May I ask who seconded it?
Glazer.
Thank you.
Great. Can we take a vote for accepting the minutes from our last meeting, please?
Dr. McAloon,
Yes.
Dr. Lee,
Yes.
Ms. Trulio Elliott,
Yes.
Ms. Chang,
Yes.
Dr. Glazer.
Yes.
Fantastic. Thank you, everyone. Next, we have a presentation from CPMA Legislative Advocate Ryan Spencer regarding AB 2194. Ryan, are you available to present to the board about this legislation?
Sam,
Great. Thank you very much. The floor is yours.
turn on my camera real quick. Thank you. First, I'd like to thank the members and your executive director for allowing me the time to discuss AB 2194 and its goal to improve the ability of PAs to assist doctors of podiatric medicine. As it stands now, as you likely know, current law authorizes PAs to assist DPMs who work in the same medical group as their supervising physician. However, the way that the law is drafted is pretty much untenable because it specifies that the PA may only assist the DPM under, quote, patient-specific orders from the supervising physician. So what this has done is it created a situation where a busy physician must then insert themselves into the care of each patient and approve every patient's treatment plan created by the PA, despite the fact that it's the DPM who's solely responsible for the actual care of the patient because it is their patient, not the physician's. And the PA, additionally, in current law, is still limited to the procedures within the DPM's scope. So the law, as it reads now, provides these unnecessary barriers, which basically finding a physician who can do this and assume liability for it. So this essentially complicates the relationship between the PA and the DPM. The reality is, as you all know, DPMs need the assistance of PAs, particularly in this world where DPAs are becoming short supply, but the patient population, particularly the elderly, is growing. Initially, when we introduced AB 2094, it would have authorized DPMs to directly supervise PAs, and this would eliminate the need for physician involvement, and that was our original goal and intent. Unfortunately, this drew significant concerns from both sides. The PAs who had an issue with someone supervising them who has what they call a limited license. And then you had the medical directors, primarily the California Orthopedic Association, who were concerned that this would expand both the scope of the DPMs and the PAs, regardless of how the language was drafted. So during the first policy committee, we worked with the consultant of that committee who actually wanted us to alleviate some of these concerns of the opposition. And it became apparent at this juncture that granting full supervision authority would not be accepted. And that was actually reaffirmed the other day when I spoke to the Senate consultant who, before I even said a word to her, expressed her concerns, frankly, opposition to that idea, which still baffles me, but that's where we are right now. So we had to pivot and try and streamline and modify existing law to still improve how PAs may be able to assist DPMs. So that's what you see in the bill today. So right now, in the current language, AB 2194 removes the requirement that patient-specific protocols would be required by the physician, and instead authorizes the PA in the same medical group or setting to assist a DPM per their practice agreement. In other words, the practice agreement would be the document to authorize the PA to assist a DPM with any patient that the DPM is providing care to without having to go back to the physician, have them devise patient-specific protocols. I will say this language is far from perfect, and I'm currently working with the stakeholders to resolve really one primary issue. It may be simple enough, but it may seem simple enough, but we want to create a situation where physicians will want to put this in the practice agreement and also not be worried about liability. So that's where we're down to right now, is trying to work out this liability issue that is haunting the bill, and frankly, why the current opposition remains. So while the liability issue is still a sticky wicket, and the author is committed to trying to fix it, we are have ongoing dialogue, and this bill is set to be heard, not set yet, but will likely be heard in the Senate Business Professions and Economic Development Committee on July 1st. So again, the goal of this bill is to remove the requirement that a physician has to actually assert themselves in the patient's care, and instead they would just basically authorize their PA to be able to help a DPM and let the PA assist the DPM with any patient in that medical group that they are able to service. And so that's the overall goal of the bill. We still need to work out the liability issues, but that's where we stand now. So thank you for your time, and I'm happy to answer any questions you may have.
Great. Thank you, Ryan. I appreciate the update for where this bill is now. That was information that I personally didn't have all that information yet. So thank you for updating us where we are now, where you are now with this bill. So with the rework of the bill to where you said, now I'm understanding, now we're asking to remove the requirement of the patient-specific plan and let the practice agreement stand as the direction of this for PAs working with podiatrists. So this would be specifically then, I'm assuming then, to medical groups, multi-specialty medical groups is where this, the places where this is a issue?
Where the bill would apply is really any setting or any healthcare setting where there is a physician that is on site. It doesn't have to be, you don't have to be a partner with the physician. It doesn't have to be specifically within the medical group, but we'll give example, although it is part of a medical group, like Kaiser, for example, would be able to utilize this. People that do partner in orthopedic, like an orthopedic/podiatric medical group would be able to benefit from this. So the bill is not specific, but ideally, I mean, realistically, that is the situation where this would occur. It wouldn't help private practice podiatrists right now in its current form, like on the onset. However, we did do a bill last year that does allow physicians and podiatrists to partner without having the physician be the majority owner of the majority voting member of the medical group, or the podiatric/physician medical group. So before, if you had 4 podiatrists and you had 1 physician, that physician would have to be the majority owner, which is ridiculous. And so that's why these partnerships never existed, but that's now gone. So theoretically, a podiatric medical group could find a physician and partner with them and utilize their PA, basically hire in quotes the physician and utilize their PA in their medical group. But it still would be, they would still be under the supervision of that physician. So that is one possible way that you can still work within the parameters of this bill. But I think even more, I guess probably the best way to explain why this bill would still be necessary is this gets rid of this barrier in existing law, tries to create a situation where it would actually work in these settings. And we're still actually trying to navigate that language in its current structure, but it's kind of lays the groundwork for the future, so we would be able to expand the law to officially help private practice. So this is not the end all be all. This is just a step. That's probably the best way for me to describe it. Hopefully that helps answer your question.
Thank you. It does. It does help understand the setting to which this is most helpful in. And with this rework of the bill, has that moved the groups that you shared with us that were initially opposed, including the PAs and the COA? Has this changed to move them away from towards accepting being in a support of this bill?
The physician assistants, yes. In fact, in its current form, they went from opposed unless amended to support. So the PA supported. The Medical Association has been very quiet. They really want us to kind of work it out before they would publicly oppose the bill. But officially, internally, they are opposed. They do still have an opposed to it. The California Orthopedic Association is still opposed. This bill did alleviate many of their concerns, but now it's down to one particular thing, and that's liability. So they're concerned that since the medical doctor is basically delegating their PA to assist a DPM, whatever the DPM and the PA, whatever services they provide, the physician is still liable because that PA has been authorized through a practice agreement that the physician authorized, and so are signed. And so we're trying to work out a way to help nullify that liability. Some stakeholders don't believe there is liability, but the ones that do, and the important ones, are the medical doctors that believe there is. And even if we are in disagreement about that, if medical doctors think that they are liable for a patient that is not even theirs, then the likelihood of this actually being more effective than current law is at issue. And so that's why this is important to try to work that out, so that when physicians do delegate their PA, they can have some assurance that there won't be liability. And so that's why the COA still remains opposed today, to have us work that out. And so that's what we're attempting to do.
Thank you. That answers my questions. I would like to invite any other board members to ask their questions, please.
Hi, Ryan. Can you hear me?
I can.
Before the presentation to the Senate on July 1st, would you be having some encounters with our other stakeholders as far as editing the language to their liking or modifying it the way you said will be appropriate? What are the plans before the hearing?
That's exactly it. I've had numerous conversations with the PAs and CMA COA through CMA to find language that would be amenable to them, and we've devised a couple different scenarios. And then in those scenarios, the PAs didn't like the way that it read. CMA had some concerns with it, so we've been back and forth. So those discussions aren't just going to happen; they are happening, and they'll continue to happen before July 1st. So yes, that we will continue to have these discussions. The author did make a commitment to work out these concerns in the Assembly Business and Professions Committee through the chair, and so that's been my priority, to try to work them through.
Great, thank you. The other question was about the liability. That seems to be a very sticky point when it comes to this bill. Can you expand on what they exactly mean by liability? Because if the scope of this bill is referring to a multidisciplinary practice, a large healthcare system, usually it's a group coverage as well that involves liability and so forth. And so did they give you any concrete examples of what liability means in the setting of a multidisciplinary large healthcare system? Because that's quite different coverage versus an individual practice or solo practice or solely a DPM practice.
No, they didn't. And you just gave me a note to go back to them and talk to them about. Their concern is about two things. One is medical malpractice, obviously. That's the big one, and also a discipline on their license. So those are the two types of liability they're most concerned with. I will say I have heard that, but not of that question being presented, but it hasn't been highlighted. And so that'll be more of a direct question that I'll ask. And I assume you're also referring to the situation where how Kaiser operates. Is that correct?
Any large healthcare system, including our government, VA, and so forth, they will have a large blanket coverage for all the physicians working within the group. So perhaps some of our stakeholders are not considering the type of liability that is being placed in a larger institution versus individual practice. So there might be a confusion there. So I was wondering if you had some specific concrete examples to what they meant by liability, because that part is a little confusing when it comes to a large institution.
I think that's a fair question, and I'll be completely honest with you. This has been a frustrating part of the process because we haven't been, but yet they still have the arguments they've made is they being the California Orthopedic Association is solely on the fact that if a physician responds to PA, they're now liable for the care as if they were treating that patient, and that has holds some weight. So I guess the question I should ask them, and we'll ask them during our next meeting, which would be early next week, is just that, like in terms of how it operates in a multidisciplinary medical group or setting, how would this be any different than the situation is now? How would that pose any more additional liability? At first, I thought it was a red herring, and then I started to dive into it, and we started trying to remedy this concerns, and maybe it is more of a concern. Maybe it's more of a concern versus a real concern. So it's something that I appreciate you bringing that up, and it's something I'll bring to their attention next time I meet to them.
And one last thing, with your presentation today, what are you seeking from the board?
Asking for yours to support the bill.
So I have a question about that liability question. Do you have stakeholders such as a large multi-specialty medical group, of which there are several in our state, who are your stakeholders and supporters, because this bill would make life easy for the organization to have their doctors more willing, their doctors, MDs or DOs, not having to insert themselves into the podiatric, I'm going to call it a clinic in that setting.
Sure.
And going from the patient practice agreement directly, would that not make these large multidisciplinary groups a benefit for them? And would they not be stakeholders in assisting with getting these questions addressed and appeased, because it would be in their interest?
That's been our argument all along, why we would like an organization like Kaiser, for example, to support the bill. They are aware of it and have engaged a lobbyist, but they have not made formal position on the bill. But that's been a primary target of mine, at least, to get them on board. And I know some conversations have happened kind of offline with some of the other stakeholders that are involved in Kaiser to try to get some concerns addressed. And so I might receive a full update on how those conversations are going, but I will prior to the hearing.
Thank you. Are there any board members in Riverside who would like to ask any questions of Mr. Spencer?
We don't have any questions. Thank you.
Thank you. Do I need to ask the public if they have?
At some point, you should ask the public if they have comments or questions. If you would like to entertain a motion first, though, you could do it that way as well.
So, Dr. Lee, based on the answer to the question to Mr. Spencer that asked, do you have any thoughts about a motion for the board in that regard?
Also, as a reminder, the board has the options to support, take a neutral stance, oppose. It can also qualify by that as support as amended, neutral if amended, oppose if amended. The board also has the option of not taking a stance at all.
Does the board need to make the motion first in order for us to just start that conversation?
You guys can discuss how you would like.
So Ryan, I'd like to get a little more information just before requesting the motion, then, since we don't have one yet. So are you, you're asking for the board to support it as of right now, as of some work between now and July 1st? What are you asking us for, if you could be as specific as possible to help us figure out? Would be appropriate.
I'm asking you to support the bill in its current form, which would remove the patient-specific protocols from statute and place in the responsibility of the PA to assist the DPM in the practice agreement, and utilize your support in helping us make an argument, a case to improve upon that language. Because if you support the intent of the bill, and we're just whatever amendments we make are going to further the intent. I will say if we can't get to a point where this bill is workable, we may pause and then go back to the drawing board. But I think having support initially would help even with that situation. If we decide that we're going to readdress this issue in the future and just can't come to an agreement on how this bill would work and make it workable, still going back to the idea that both the Podiatric community believes that PAs are a valuable part of their team and could utilize their assistance, is really the message that I think we would like to put out there.
And just to confirm, in its current forms, the PAs have moved to a support of this bill.
That's correct, and I'm doing my best to keep them there. And that's what made this conversation. That's what made these negotiations very difficult, because some of the amendments that the Medical Association and COA we've talked about, even though they haven't presented any amendments, some of the ideas which I believe would address some of the liability issues, would place DPMs in a supervisorial role, at least apparently, and that's something that the PAs oppose, and of course so does the Senate committee. So we wouldn't be able to do that anyways. Senate consultant, I shouldn't say the committee. And so yes, that's my goal, and that is something that, since we made an agreement, that I'll keep that agreement. So that's what we're trying to do.
Thank you. Brendan, can I ask for public comment before we have a motion?
Yes, go ahead.
Okay, I would then like to request to see if there's any public attendees that would like to ask questions or make comments on the current conversation about this bill.
Madam President, it might be helpful to go down Riverside, Sacramento online, so people just kind of have a general idea of where we're asking public comment from.
Okay, very good. Is there anyone in Riverside that would like to make a public comment on this conversation?
We have no questions from public, but board members do have some questions when we come back to it.
All right, I'll proceed with the public comment since that's where we are, but I will come back. Thank you. Is there anyone online from the public who would like to have any questions or comments on this discussion? I'm not seeing any. Is there anyone in Sacramento from the public that would like to make a comment or question about this discussion? Very well, then back to Riverside board members. Please proceed with your questions for Mr. Spencer or amongst us.
Okay, Charlene Trujillo Elliott here. My quick question is, because we do not have a meeting until the fall, and would it be possible to, and again, I guess this is a question for legal, if we can give authority to our president or chair to again do a letter of support when it gets closer to the bill actually being more defined?
I think the board would have to take a support if amended approach at this point for that, with an idea of what it would like to see it as being supported, or as amended. So I think if the board would like the executive officer to advocate the board's position at the legislature, it should take a official stance at this meeting.
Okay. All righty. Next board member.
Ryan, I'm assuming this bill, the intent is to help with access of care to patients, and that's why we need this on board. Is that correct?
That's correct. And I will add, if that is the if we have a commonality and believe that is something that we should promote, that's what this bill will do and will continue to do, in this vehicle or the next vehicle. And the language that we are trying to address has to do with liability. If the board doesn't believe that that is a huge issue that is withholding them from supporting it, in other words, if this bill, if I came here and told you that I'm not working on language regarding trying to remove liability from the physician, would that change your position? Would you be supportive of the bill? Because what we're trying to do here is to just find a way to ensure that PAs are free to assist DPMs and they're going to be able to assist DPMs. And the one way we can actually resolve that and is putting some peace of mind for the medical doctors. It's really the medical doctors, the ones that really want, at least what I heard from their association, this liability protection. I will talk to them about there's certain settings where this really is an issue and kind of try to get some more clarity on that based on what Dr. Lee just asked. But for the most part, I would say if you do a support if amended, that means that you don't support the bill because you believe that liability is something that is a big issue and needs to be addressed. And at least that's how it is interpreted in the legislature. So if you, whatever position you decide, I think I just want to be cognizant of how that's phrased.
I think from a licensing board standpoint, liability being appropriated correctly is understandable. I don't know how the medical board feels about that from their side, but also, we are advocates for the public and making sure that whatever we do is going to increase the level of urgent care for any patients is obviously one of our parameters that we need to look towards.
Exactly.
Are there any other board members in Riverside that would like to contribute to the conversation at this?
We're good.
So my thoughts about this bill and to our discussion, the role of the mission of this board is the thoughts that I think conceptually having access to care by the right provider at the right time is at the right place is an overarching service to the public. So in that perspective, I think that these kind of access to care issues are something in general for us to support in the conceptual of it. The other piece that makes comfort-wise is this is not a mandate. We must have a PA, a DPM, and an MD or DO willing to follow this bill should it pass. And so that's a choice. There is a choice on the provider side whether or not for a DPM and a PA and an MD or DO to participate together providing patient care. And this bill would not mandate that they did, only that they could if all parties chose to. And again, regarding working out the liability, because of that part that this is choice and not a mandate, I would say that would alleviate concerns perhaps that we might have at the clinical level, because it would have to be acceptable to the and not a mandate for it. So those two reasons, access to care and that this is an opportunity but not a mandate, gives me a comfort, and that the physician's assistants are wanting to work with us on, work with the maker on this bill, are the concepts that I'm comfortable with right now, and to see what everyone else thought about that.
Yes, I agree, with Madam President. I think putting our patients in the middle, in the center, and providing them access to urgent, immediate patient care coordination as we work in, let's say, large institutions and so forth, I think is the goal. And that's the way I see it as well from this type of bill. So with that in mind, I would support it. I feel positive about it. I think there are some language issues that perhaps our stakeholders would like to see it changed in the future, and I welcome that. And granted, we have our next meeting in the fall, so we'll look forward to any changes to it. But as it stands, this seems to be going in a positive direction.
Riverside board members, do you have any additional comments?
No comment? We have a motion though?
I was going to ask, with that, Dr. Lee, would you be feeling comfortable making a motion regarding this issue at this time?
Certainly. The motion will be to for the board to support this bill as it's been amended thus far.
Sorry, to clarify, the board would be moving to support the bill in its current.
In its current language.
Okay.
And is that a reasonable motion to proceed with,
Yeah, that's a reasonable motion. We would just need a second. Also, I like to take public comment on any motion, so
Okay.
do public comment again.
So first, I'd like to request from a board member a second on the motion that's on the floor.
I'll go ahead and second it, Darlene.
Thank you very much. Now that we have a motion that's been made and seconded, I'd like to request a public comment. Not to go and move it around. This time I'd like to ask any public online if they have any comments on the motion before us at this time.
We are open for public comment on the motion. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users dial *3 to raise a hand, and we will call on people in the order we have requests. We're going to take a few seconds now to see if we have a request for public comment. Seeing no request online, should we check? Hold on just a moment. We have a hand up. Douglas Taylor, we're going to send you a request to unmute your microphone. You'll be given 2 minutes to speak, and I'll give you a 15-second warning before your time expires.
I think this is a great move and with regard to the board to support this bill.
Thank you. Is there any further public comment from our online members?
We are finished with public comment online. With that, shall we check in with Sacramento and Riverside?
Yes, please. Is there any public comment from the public members in Sacramento on this motion before us? No, there is not. In Riverside, are there any public comment?
Do you have any? No. No public comment in Riverside.
Thank you. Is there any additional discussion from board members before a vote is called on this motion? Seeing none, may we call for a vote on the motion as it stands, please? Which is, if you could read it, call for the vote, I would appreciate it. Thank you.
Dr. Lee moved and Ms. Elliott's seconded that the board is to support AB 2194 as it has been amended in its current language.
Thank you.
Okay, so I will now take the vote. Dr. McAloon?
Support.
Dr. Lee?
Support.
Ms. Trulio Elliott?
I
Ms. Chang?
support.
Dr. Glazier?
Support.
Motion passes.
Great, thank you very much. Mr. Spencer, thank you very much for joining us for the meeting today to educate us on this bill and to get us the updates and the environment in which this bill is working through. I would ask that you be so kind as to continue to keep us as a stakeholder in the loop about any changes that are made and accepted so that we can continue to be knowledgeable about the bill to which we have agreed to support. And our preferred communication probably is for directly to our EO with any updates that you might have, and then he could pass it on to the rest of us for information that we need about any major changes, whether moving forward or not at this time. If you could keep us in the loop, that would be very appreciated.
Absolutely. Thank you guys for the support. Appreciate it very much. Thank you.
Thanks.
Madam President, quick point of order. I just received a question from staff of whether we took public comment on the meeting minutes. Just to do our due diligence, I think we should just ask for public comment on the meeting minutes at this point.
I'm confident that I did.
Oh, you did? Perfect. Great. I wasn't sure about myself, so that is why I thought I should check with it. So if you're
I have a specific recollection that I did.
great. I wasn't entirely sure either way, so I appreciate the confirmation. So appreciate that.
Thank you. All right, so moving on, we'll move to our executive officers' reports. And then since the first report is our licensing program, And as Dr. Patel is not here and I am on that committee, I will move forward with the licensing program update and ask our fabulous staff member to give the report.
Thank you. Good morning. So the following information is for the third quarter of fiscal year 23-24 between January 1st and March 31st. There were 30 newly licensed DPMs, and there are currently 24 pending applications with 0 candidates that recently completed their package. So far, PMBC has 23 applicants from out of state, 24 are third-year residents from California, and 21 are third-year residents from an out-of-state program. Moving on to renewals, there were 253 renewals mailed with 235 licenses renewed by the third quarter. Next, we have the residents. There were 2 residents added to the second-year resident rotation list, bringing the resident license total count to 131. And then we have the 3-month timeline. Is there any questions so far on that portion? No? Okay. Finally, we have 20 separate California postgraduate clinical training programs that are seeking approval of applications for residency programs offered for the 2024-2025 academic year. The licensing committee reviewed these applications and recommended approval at the May 7th committee meeting to the full board.
Thank you. So as discussed here about the licensing program annually, the residencies here in California are required to submit an application for ongoing approval from the licensing board to license their residents. We do heavily rely on the CPME's evaluation of these residency programs, as we do not independently evaluate the on-site programs. We take their on-site visits as data in our decision-making and making sure they meet the, as you can see on the licensing board report, the board may approve a residency provided that the program reasonably conforms with accreditation for graduate medical education, is approved by the Council on Podiatric Medical Education, has a designated medical director of medical education, provides an emergency room rotation, measures and evaluates the progress of its residents, and the measures and evaluates the progress of its, the effectiveness of its program, and has a minimum 75% resident pass rate, which is reported to, this information is reported to us by the residency directors when they complete their application for approval. The licensing committee has reviewed these applications against the guidelines that this board uses and has made the suggestion, the recommendation to the entire board that on total to approve the applications that sit before us. And so as a member of this committee, I make a motion to the full board to accept the applications for approval of residency programs that we have before us. May I have a second on that motion, please?
Second, Daniel Lee.
Thank you. Now I'd like to ask board members if there's any discussion on the motion before us to accept the applications for approval for the residency programs in California for the academic year 2024-25. Great, then we'll ask for public comment then on the board's motion to accept these applications. Is there any Sacramento public member comments on the applications for residency approvals in California? Is there any public comment in the Riverside office on these applications for approval for residency programs? Thank you. Is there any public comment from our online guests on the review of the residency program recommendation for approval in California?
We are open for public comment on the motion via WebEx. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial in dial *3 to raise a hand, and we will call on people in the order we have requests. We're going to take just a few seconds now to see if we have a request for public comment. Seeing no request online, shall we check in on Riverside?
Yes,
No public comment?
thank you. Then may we take a vote then on the motion on the floor to accept the licensing committee's recommendations for approval of California podiatric residency programs for academic year 2024, 2025, please.
Yes. Dr. McAloon?
Approve. Approve.
Approve. Okay. Dr. Lee?
Approve.
Miss Trujillo Elliott?
Approve.
Miss Chang?
Approve.
Dr. Glazier?
Approve.
Motion passes.
Great, thank you very much, everyone. That is the report from the licensing program. I think it's fine to move forward now to the next one. And so the next report is on the enforcement program. And Mr. Trujillo Elliott, may I ask you to introduce the report from the enforcement program?
Yes, I'm going to go ahead and ask staff Bethany to step forward and give the enforcement program.
Thank you very much.
Thank you.
Good morning. Today's enforcement report covers the third quarter of fiscal year 23-24. That's January 1st through March 31st. And it's compared to third quarter data from 1 year ago. Starting with the complaint data, we had a total of 34 complaints received during quarter 3, a 21% increase over a year ago. And the average days to assign a case was 7 days. The investigation data, we had 34 desk investigations assigned and 28 investigations completed. Desk investigation processing time averaged 66 days, a 16% decrease over the prior year. I do have a blurb in here that we had lost our consumer complaint analyst for our medical board from March to June of 2023. She returned and got caught up in all of the complaints. However, as of June 1st, she has re-retired. So that may cause a delay in some of our desk processing times for a while until that's reassigned. Moving on to field investigations, we had 1 assigned during the third quarter and 1 case completed. That case took 141 days, a 73% decrease over the prior quarter, I should say third quarter, which averaged 521 days. So case investigation times for both desk and field averaged 118 days. Also, it shows that investigation aging data that of the 26 investigations closed, 17 were closed within 90 days, 6 were closed between 91 days to 1 year, and 3 took longer than 1 year to close. Moving on to the disciplinary data, we had 1 case initiated during the third quarter, same as the prior third quarter, when 1 final order went into effect, compared to none the year before. That case took 449 days to complete. No citations were issued during the third quarter. We had 1 probationer added during quarter 3, and 8 active licensees were on probation at the end of quarter 3. Finally, we have the enforcement year-to-date total. So this is covers quarters 1, 2, and 3. So we have complaint intake increase of 26%, a total of 107 complaints received for the year-to-date compared to 85 the year before. We had an investigation increase of 29%, the same number of 107 investigations assigned. And average days to complete investigations for desk and field is at 124 days so far for the year, which is a 30% decrease from the year before. So that's good. We had a total of 5 disciplinary cases initiated with the Attorney General's office, which is a decrease of 29% from 7 the year before. And disciplinary cases have averaged 992 days to complete, which is a 29% decrease from the 1,400 days average from the prior year. We had 5 final orders for the year before, and no accusations were withdrawn, dismissed, or declined. Finally, we have the Attorney General case aging data. This is information received directly from their office and includes information through April 15th of 2024. We currently have 11 plus pending cases with the Attorney General's office. Some are still pending review and have not been formally accepted, so that number is probably a little bit higher. And then we do have a link in the report showing the performance measures with DCA that has information for many years and quarters of enforcement and licensing data. So that can be found at those links provided in the report. That concludes the enforcement statistics. Are there any questions on this portion of the report?
Do you have a question?
Yes.
Seven laser increasing complaints seems pretty large. Do we have any theories on why, and if those accusations were considered a lower level accusation, I take every accusation seriously, egregious accusations?
So I had a lot of trouble understanding that question comment. Maybe you could repeat it. I'll try listening.
The complaint level was a drastic increase, it seemed like, from previous quarter last year. Do we have any theories on why? And if those complaints were considered a lower level accusation, even though we take every accusation seriously, or more egregious accusation or accusations?
Okay, so it sounds like a two-part question. I still didn't fully hear it. It sounded like number of complaints have increased quite a bit, but also the accusations, something about the accusations.
Are the accusations a lower level accusation, or is this a more egregious accusation or accusations? Meaning the severity of the accusation, are they, would you consider minor or major?
There's a combination of cases of severity. I don't really know. So, I mean, some might end up in a public reprimand, some a probation, and some a surrender or a revocation. It's all different levels of severity and usually is that way from year to year. I can't tell you off the top of my head how many are severe, more severe than others.
I should make that question clear. The basis is, are we seeing a trend in severity of of accusations as we're seeing a trend in increase in complaints?
No, I haven't seen the correlation between the increase in complaints and more severe activity. Because we are such a small board and get a small number of complaints, the statistics can appear to be really drastically different from year to year. But usually when you compare year to year data, like next quarter, at the next report, I'll have multiple years of data of how many complaints we've received, how much action is taken. And it usually tends to kind of correlate over time and kind of even out. So what looks like a big statistical anomaly or whatever is really not that high in numbers, or not that big, if you understand what I'm trying to say.
That was good.
Okay, any other questions on the statistical portion? Okay, so I just have another really short portion of the report, the probation program update and cost recovery. So between January 1st and March 31st, we received $23,301.33 in cost recovery, $525.29 in probation monitoring payments, and $1,000 in citation payments, for a total of $24,826.62 for quarter three. This concludes my report. So if anyone has any additional questions on that portion or any other enforcement questions, I can take those now.
Do any of our Riverside board members have any additional questions on the enforcement program report?
We have none.
Thank you. Do any public members in the Riverside location have questions about the the enforcement report?
We have none.
Anyone in public members in Sacramento have any questions about the enforcement program report? Are any public members online having any questions in regards to the enforcement program report?
We are open for public comment via WebEx. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users dial *3 to raise a hand. We will call on people in the order we have requests. And first, we're going to hear from Douglas Taylor, DPM. Hold on just a moment. We're sending you a request to unmute your microphone.
Douglas Taylor, a CPMA board member. Just a quick question on that $24,000 figure that you mentioned. How does that break down?
As far as the breakdown, it was the cost recovery payments that we received from the investigative and attorney general costs incurred in the case, and then probation monitoring fines for the monitoring work done on probationers and a citation. Is that the question you
That's
had?
great. Yes, thank you.
And that was our only request for comment via WebEx.
Thank you very much. I'd like to thank the Enforcement Program Committee for their hard work and their report to our board meeting. And I'd like to ask Dr. Daniel Lee to introduce the Legislative and Regulation Program report.
My mic was off. For the item C, Kathleen, could you help us with the presentation for this portion?
Yes, Dr. Lee, thank you. Good morning. The first item on the agenda for the legislative report is AB 2194, Patterson's Bill for Physician's Assistance and Supervision by Doctors of Podiatric Medicine. This was dealt with at the beginning of this meeting, and just to summarize for those listening online at a later date, please refer to an earlier portion of the meeting, and you will find that the board did vote to support this bill in its current language. So there was a full discussion earlier in the meeting. Any questions? Okay. The second part of the legislative report deals with the regulatory program update, which includes AB 826, continuing medical education, which was passed last year. And it was continuing competence was removed from the requirements for DPM renewal. And we are in the middle of applying for the regulatory updates on that. It's called a Section 100. It's not substantive. It's just making sure that the language is current with the legislation. So the regs agree with the legislation. And that should be submitted before the next board meeting. Any questions on that? Thank you. That is my ledge report.
Thank you, Kathleen.
Are there any questions from our Riverside board members in the Riverside location about the Legislative and Regulation Program report given today?
No questions.
No questions.
Are there any questions from any public members in the Riverside location regarding this report?
None.
Thank you. Are there any public members in our Sacramento location with questions for this report? Thank you. Are there any online public members interested in asking any questions or giving any comment on the Legislative and Regulation Program report just received?
We are open for public comment via WebEx. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial in users dial *3 to raise a hand, and we will call on people in the order we have requests. We're going to take just a few seconds now to see if we have a request for public comment. Seeing no request for public comment online, do you wish to continue with the agenda?
Yes, thank you very much. And Darlene, back to you for the public education report, please.
Thank you. I'm going to go ahead and ask Kathleen to go ahead and give the presentation for public education.
Thank you, Ms. Elliott. This is the report for the public education program. The committee met and we discussed the current content, which is mostly all been submitted. We're working on one sensitive article, which has to do with some discussion from the last board meeting about issues that will come before the sunset review next year, and also advocating for the board as it exists, as an independent board, and Brian Naslin and I are working on that. We should be submitting that to legal for their review shortly and expect that this will be published sometime this summer before the next board meeting. Any questions on the publication of the next issue of footnotes?
I just have a comment. Is there a way that the board members could receive a draft copy of that before it goes out?
Absolutely. Yes.
That would be beneficial. Thank you. I do think that anything coming, communication, that broad spectrum from the board should have a quick peek at it before the public. So thank you, please.
Yes, that will be helpful to us too. Other than that, I'll conclude that section of the report. The second section has to do with our website, the PMBC website, and our social media accounts. As usual, we invite people to let us know if they're noticing things on the website that they would like to see changed or updated. And I just want to renew that request from all people listening. Mostly that website has become extremely active in terms of the licensing renewals. And I think at that point, a lot of people do visit other sections of the website. So if that's easy on our DPM licensees, please feel free to send us something through the PMBC mailbox or directly contact one of us here at the office. As far as the Facebook and Twitter accounts, when there are newsworthy events, either it comes from the governor or DCA or ourselves, we do publish those. Although we're not extremely active in that area, we do keep up to date. So any comments on that, please let us know. And that concludes my public education report.
Thank you. Thank you. Mr. Elliott, do you have any further comments on the public education report at this meeting?
No, I just wanted to thank staff for their presentation.
Indeed, thank you very much. Is there any discussion from any of the board members at the Riverside location in regards to the public education report?
We have none.
Thank you. Are there any comments from the public members in Sacramento on the public education report? Is there any public comment from Riverside public members on the report?
We have none.
Thank you. Is there any public comment from our online guests regarding the public education report?
We are once again open for public comment via WebEx. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users dial *3 to raise a hand. And our first request comes from Douglas Taylor, DPM. Hold on just a moment. We're sending you a request to unmute your microphone.
Douglas Taylor, CPMA board member. I noticed on the website there was an article on ranking podiatry schools, and some of the California schools were not necessarily at the top of the list. And I know there's an issue of recruiting students to our California schools. The report might be accurate, but I didn't know if it would be detrimental if I was a student looking to apply to a podiatry school.
On the PMDC website, there's a ranking of the schools of podiatric medicine.
Dr. Taylor, I'll be happy to look into that. At this point, I'm not familiar with that page on the website, but if we're linking to it and it's not our content, that would make more sense to me. I don't remember publishing, and I do publish things like that. So well, maybe we could table that until the next board meeting. It is a very important issue. We understand why you would bring that up, and we'll look into it and see if we can address it at the next board meeting. Would that be okay?
This is the moderator. Mr. Taylor has put himself on mute. Oh, he's back.
Perfect. Thank you.
Great. Thank you for bringing that to our attention. We will look into that further. Is there any other public comment on the public education report received today?
That was our only request online.
Fantastic, thank you. Then we'll move to the executive management report, and I would ask our EO to update us on that report.
All right. Thank you, Madam President. This is just a discussion about the upcoming sunset hearing in 2025. After this board meeting, I know I'm going to get water balloons thrown at me by my staff, but we're going to start this on Monday. And we're going to try to have a finished project for the October for your discussion. So, is it there? Oh, I'm not close enough. So yeah, we're going to try to start the sunset hearing report. I'll have a meeting in July. We don't have the new template that they send out yet. It's going to be set. We're using 2024's template, which should be the same, so we can get all the stats and everything going on that. So I will definitely keep you posted, especially in the committees as we get closer to the October meeting.
So Brian, can you give us an overview of the overall timeline of sunset review, big picture timeline about that process?
Yeah, so we usually start right about this time now, and I think, if I'm correct, because it's been 4 years ago, I think, Kathy, don't we submit it November? Yeah. So, and then goes through the process, and then we're at the hearings usually in March. Yeah.
So we're looking at approximately a 9-month process.
It is.
Starting next month to finishing up in March with that process.
Right.
Okay.
And it's a lot of staff hours too, so it's just, yeah, a lot. And this is just another FYI, in October, at the full board meeting, we're going to be electing new board officers. So I just want to put that on your radar. And it would be Dr. McAloon, who would be kind of in charge of that.
Okay.
And then go from there. There will be a discussion of president, vice president, secretary, and the nominations and a vote. So I just want to put that on your
So
radar.
at that meeting, I would bring forward a slate for the board to vote?
Yes.
Thank you.
That's all I have. I wish I had more, but I think I will in October.
Sounds like that'll be a busy meeting. Are there any questions from our Riverside Location Board members regarding the sunset hearing or the board slate that Brian discussed for the new officers for the October meeting? Basically, is there any comments on the executive management update?
I have a quick question. In our last meeting, we talked about, again, the fees. Is that going to be covered in sunset, or is this going to be a separate item?
That will be covered in sunset, yes. And that's what the meetings in July and stuff I'll be going to.
Okay.
Of how we do that, but the fees will be covered in sunset.
Thank you.
Are there any other questions regarding today's executive management report from our board members? Then I'd like to open up that report to public comment. This time I'll start with our online guests. Is there any public members online that would like to have questions or comments on the executive management report?
We are open for public comment via WebEx. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users dial *3 to raise a hand, and we will call on people in the order we have requests. We're going to take just a few seconds now to see if we have a request for public comment. Seeing no request online, shall we check in with Sacramento and Riverside?
Thank you very much. Are there any public members in Riverside with a comment on our executive management report?
No comments up here?
Thank you. In Sacramento, are there any public members with comments on our report? There are none. Thank you very much. So that concludes the executive officers' reports on the different programs here at the Podiatric Medical Board of California. Do I need to ask to vote to accept all those reports in totality?
And do public comment on the motion too.
Okay, thank you. I'll make a motion then to receive the 5 program reports to the Podiatric Medical Board of California. May I have a second?
Daniel Lee, second.
Thank you. Are there any board member comments on the motion to accept all the reports that we received?
No comments here?
Thank you. Any Sacramento public member comments on receiving all reports? Thank you. Any Riverside public member comments on receiving all reports?
And no comments here.
Online, are there any public comments about the Podiatric Medical Board of California receiving these 5 program reports from the executive officer?
We are open for public comment on the motion via WebEx. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial in users dial *3 to raise a hand, and we will call on people in the order we have requests. We're going to take just a few seconds now to see if we have a request for public comment. Seeing no request online, shall we continue with the motion?
Yes, please. Can we take a vote, please, on that motion?
Okay, Dr. McAloon,
I accept.
Dr. Lee,
I accept.
Ms. Trulio Elliott,
Accept.
Ms. Chang,
Accept.
Dr. Glazier.
Accept.
Motion passes.
Fantastic. Thank you very much. Well, we're going to move next to our future agenda items, but I would just like to mention that this might be a record for a board meeting, but I don't want this to be any indication of what's going to go down in October with how much time we're going to need to be together. So I suppose if you average it out, we get a little bit of a break today, but in October, I would not expect to be out before noon, just FYI. So at this point, I would like to first from the, request any future agenda items from any of our board members.
We have none in Riverside.
Thank you. From any public members in Riverside, are there any future agenda item requests?
None.
In Sacramento, any comments for future agenda items? Thank you. For our online public members, are there any comments on future agenda items for this board?
We are open via WebEx for agenda item 7. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial in users, dial *3 to raise a hand, and we will call on people in the order we have requests. We're going to take just a few seconds now to see if we have a request for public comment. Seeing no request online, shall we continue with the agenda?
Yes, thank you very much. I would like to thank the public members who attended our meeting today and participated as well. I'd like to thank our staff for being well organized and well prepared for this board meeting, which contributed to its efficiency.
And I would like to just have a friendly reminder to our members in Riverside that once the meeting is over, you cannot discuss board business with each other.
Thank you for that reminder. As we've concluded the business before us at the Podiatric Medical Board of California's June 7th meeting, I call this meeting adjourned.
Thank you, and we will be signing off.